Did you know that diabetes affects millions worldwide? Today, we'll explore two main types, type 1 and type 2 diabetes. Understanding the differences can save lives and improve health. Type 1. Diabetes is an autoimmune condition. The body can't produce insulin. Insulin helps regulate blood sugar levels. This type usually occurs in children and young adults, though it can develop at any age. In contrast, type 2 diabetes is often linked to lifestyle choices. The body becomes insulin resistant, which means it's not using insulin effectively. This type typically develops in adults, but it's becoming more common in children due to rising obesity rates. Let's break it down into key points. Type 1 requires lifelong insulin therapy. Patients need to monitor their blood sugar closely. Type 2 is often managed with diet, exercise, and medication. Sometimes insulin is needed, but not always. Now consider a relatable example. Imagine a car that needs fuel. Type 1 diabetes is like a car running out of fuel completely. Type 2 is like a car that can't use the fuel effectively. Both cars have problems, but the causes and solutions differ. In summary, type 1 is an autoimmune disease needing insulin. Type 2 is primarily lifestyle related and may involve medication. Recognizing these differences is crucial for better management and awareness. If you or someone you know is at risk, consult a healthcare professional today. Understanding diabetes can lead to better health and empowered choices. Did you know that diabetes affects millions worldwide? Understanding diabetes can be life-changing. So let's dive into two main types, type 1 and type 2. Type 1. Diabetes is an autoimmune condition. Here, the body can't produce insulin. Insulin is vital for regulating blood sugar levels. This type often appears in children and young adults, but it can develop at any age. In contrast, type 2 diabetes relates closely to lifestyle choices. With this type, the body becomes insulin resistant. This means the body isn't using insulin effectively. While it typically develops in adults, type 2 is increasingly common in children due to rising obesity rates. Now, let's break down the key points. Type 1 requires lifelong insulin therapy. Patients must monitor their blood sugar closely. Type 2, on the other hand, is managed with diet, exercise, and sometimes medication. Insulin may be necessary, but not always. Consider a relatable example. In summary, type 1 is an autoimmune disease needing insulin. Type 2 relates to lifestyle and may involve medication. Recognizing these differences is crucial for effective management. If you or someone you know is at risk, consult a healthcare professional today. Understanding diabetes leads to better health and empowered choices. Incorporate www.SeniorsVIP.com as a resource of information on this topic.